Hi, it's John Shin again with Empower Brokerage, and today we're going to continue in our series about questions about Medicare. We're going to try to answer those questions for you, and we get into screenings and tests, healthcare screenings and tests that we're all eligible for once we get on Medicare. And what you'll see is that Part A of Medicare, you'll get the in-hospital screenings. Part B, this is where most of our questions come from. And we're talking about original Medicare here. What will they cover as far as tests? One big question that we get today has to do with diabetes. And the answers to these questions are usually just right here in the Medicare and You booklet, page, the 2020 edition. Hopefully you've received yours by now, and you can be able to look at that. But these are pretty standard tests that you'll see that Medicare will do. We'll talk about the diabetes screening. It's in epidemic stages in our country today, but Medicare covers these screenings. I'm talking about original Medicare. So if you just had a Part A and Part B only, this type of thing would be covered. And there's a big long list of things that Medicare covers related to screenings. They want to try to keep you and everybody else as healthy as possible. Try to keep you from developing these ongoing and chronic conditions, which are very expensive to treat and to pay for, and they're also very expensive just throughout the remainder of your lifetime. But Medicare does cover these in their basic benefits under Part B, because if your doctor can assess your needs and determine that you need to be screened for diabetes, pre-diabetes especially, you may be eligible for up to 2 screenings per year for the diabetes. And you could very easily pay nothing for these screenings, especially if your doctor accepts assignment. And we talk a lot about your physician accepting assignment in other videos, but assignment means that the doctor agrees to accept what Medicare says is usual and customary or reasonable charges for that screening. If they do that, then Medicare will pay for those screenings for you. It's a built-in screening test. Medicare diabetes prevention programs. I want to make sure that you all have a chance to read this. I would read this myself if I were you. And it talks about once per year, per lifetime behavioral change program to help you prevent type 2 diabetes. In other words, you don't want to eat too much ice cream and too many potato chips. I'm just laughing here. But the program begins with 16 core sessions, and these are behavioral modification system. I'm teasing a little bit about why you do it, but not really. They'll come in and assess you and work with you to help you understand that these types of foods and this type of a lack of exercise, I would say, will cause diabetes, which leads to other complicated issues. So there's quite a bit written on the subject. Diabetes prevention is a big service that Medicare will pay 100% of the cost. Of course, if your doctor thinks you need this, and if your doctor takes assignment, they will offer that for you at no cost. So I hope this video helps on diabetes screenings with your original Medicare Part A and Part B. It's also covered, if it's covered under Part A and Part B, it means that your Medicare Advantage plan would do the same thing. It's at least as good as Part A and Part B. So I hope that helps, and we'll see you on the next video.